how do you feel about healthcare in your country?
In my country,
Yeah.
it's slow, it's expensive, it's slow and it's expensive, and we are losing our best and our brightest through overseas.
So how do you think it compares to Hong Kong?
Hong Kong's is far superior. I tend to use the private health service in Hong Kong more than the government one. But I have used the government one, and the government one is far superior to the New Zealand experience. It's still slow, but much more value for the money.
Do you think there's any corruption in the health industry?
A lot of opinion-based things. There's the science of medicine, but then there's also what people think is good for you, and especially when you add in the cultural part of Chinese medicine, that kind of thing. It's open to abuse.
And do you trust doctors?
No.
Oh.
Want me to tell you why?
Yeah.
Okay. I don't trust doctors because the first 3 times I go to see them, they're telling me, take this pill, come back, and then pay me another $200, and I'll give you some more pills to take. After the 3rd time, just recently, when I was nearly dead, then he said, maybe there's something really wrong with you. I'll stop giving you the fake pills and send you to a doctor.
Do you feel the doctor has given you any inappropriate, unnecessary, or delayed treatment?
Well, I don't think so. I think the doctors in Hong Kong have been very professional. They only ask the uncomfortable questions when they really need to. And even if there is some physical contact, I understand that they're trying to help my health rather than do any ulterior motives.
Okay, so then why do you change hospitals?
The reason I changed hospital is because I first went into a more generalized hospital, because that was an emergency. Therefore, they weren't exactly clear of my condition and how to treat me properly. So after they've diagnosed me properly, after they've realized that I have tuberculosis, they changed me to Grantham Hospital, which is more specialized in chest care. Therefore, I swapped because one was more specialized to treat my condition than the emergency room, the first hospital I went to.
All the hospitals, were they public or private?
They were all government hospitals, so yes, they were public hospitals. If you want me to compare the two, it's quite similar to what a public school would be and a private school would be. The public one is sure, maybe dirtier. The things are less refined and beautiful. But one, it's cheaper. It's affordable for people that are in desperate need, while the private hospitals have astronomical charges to them.
Okay, so how do you compare healthcare between your home country and Hong Kong?
Well, my home country, healthcare is free, no matter what company you work for, no matter what you do. It's part of the government policy. In Hong Kong, I think it's better to get the private medical care, but I haven't had the experience that yet, so I'm not too familiar.
Okay, where are you? Do you know any form of corruption in the medical industry?
Any form of corruption? No, I've seen no corruption in the medical.
Really? Okay, I could give you an example.
Go for it.
Do you know in Hong Kong there's a patient that had a surgical thread in their eye, even after surgery?
A surgical thread?
Yeah.
And that's corruption?
No, because basically you, how I put this, you're negligent in your.
Right. Yes, I think you can make mistakes. I think in any country you can make mistakes as a doctor, but whether or not you corrupt and you're accepting payments for, as in a bribe or something, that's something else. But I think mistakes are pretty common in any field.
Do you know recently in UK there's also a doctor called Dr. Garba who was actually convicted of manslaughter and negligence over the death of a 6-year-old, but then won the appeal anyway, and many people, especially the parents of the child, got really upset about it.
Right, so if he yeah, if he's made a big mistake like that, whether or not he accepted money for the mistake, that's something else. If he was negligent or he was under the influence while he performed the procedure, then yeah, he should go to prison. Definitely.
Okay, so what do you think is the differences for malpractices between China and Hong Kong?
There are lots of differences between Hong Kong and mainland of China's medical. First of all, their system are totally different. Hong Kong is just like UK using national health service. So if you go to a public hospital, it is almost free or pay very limited. It is fair for everyone, but it's not efficient. People need to wait for long, even do a very simple operation. In China, we have the social medical care, but only part of the fee is paid by this system, and we still need to pay for a lot of money. But actually, the rest of the pay, some of the fee is by ourselves, some is by the company insurance, but depends on the individual case and also the different medicines. For myself, I lived in, as everyone know, I lived in mainland before. Then I moved to Hong Kong. In mainland, if I got ill, I just go to hospital directly. It's very convenient. But in Hong Kong, I just normally go to the clinic, and the clinic in Hong Kong is more trustable. But in China, the clinic is not that trustable. So normally we just go to hospital directly. That's the biggest difference in our daily life for the medical.
After interviewing people of different countries, we find out that the most common form of malpractice are medication errors. In Hong Kong, although some would prescribe themselves traditional Chinese medicine, both the public and private hospitals have been praised for its cheap price and refined medical treatment, since it's backed up by a compatible regulatory system. In contrast, countries with larger populations have medical treatment that are often delayed, leading to higher acceptance rate of doctors to help the long lines of patients despite being unqualified. The expensive cost doctors to be negligent and be easily bribed due to greed. We do not wish for allowing people's faith in the health system to be weakened nor raise inquiries. The health system is massive but could also result in getting everyone sick if the issue persists. So aside from having hospitals hire more qualified doctors to minimize doctor stress and workloads, there is something we could do to help as well. We should maintain an open communication with each other by giving enough details about our conditions and full consent in order to prevent any misunderstandings and for doctors who prescribe proper medication treatment for us. This is our video. Thank you for watching.